Welcome to Eight Mind Up. Today we'll be talking about diclofenac. We have the brand name of diclofenac. We have the botany. We have the cataflam. We have it in clofenac, and we have it in phenac, and a lot of more. And what are the therapeutic class of diclofenac? We have analgesic is used as analgesic, antipyretic, and anti-inflammatory. And what is the pharmacology class of diclofenac? It belongs to the what? Non-steroidal anti-inflammatory drug, which is abbreviated as NSAID. And what is the dosage form of diclofenac? We have it in tablet, oral suspension, topical gel, and injectable solution. And what are the strengths of diclofenac that has been produced? We have like tablet, we have 25 milligram, we have it in 50 milligram, we have it in 75 milligram, and we also have it in 100 milligram. And the syrups, like this, the same as suspension, we have in 25 milligram per 5 mil, and the gels, which is rubbed in our in the external body, we have it in 1 to 2%, and we also have in 3%, and we also have it in injection, which is 75 milligram per 3 mil. And we also have it in eye drop solution, which is 0.1% to 2.5 mil, and we also have it in 0.1% to 5 mil. And what are the pharmacokinetics of this diclofenac? Diclofenac is rapidly absorbed in our body, and the metabolism, it is metabolized by in the liver by this enzyme CYP269, and is excreted in our body through what? Through kidney. And what are the uses of diclofenac? Diclofenac it is used in mid to moderate pain like headache. We have dentals, and we also have musculoskeletals. And we also use it in inflammatory condition whereby the arthritis, that is inflammation due to the what? Collagen, or due to the bone like osteoarthritis. We also use this in bursitis. This is a small fluid ear sac in our between our bone, between the joint of our bone. And once there is inflammation there, it can lead to pain and other condition, and that's why diclofenac is used in bursitis, and also what? Tendonitis, and also uses in what? In dysmenorrhea, that is painful in during menstruation, and we also use in fever, that is when there is high temperature in the body. And what is the mechanism of action of diclofenac? Now, diclofenac is worked by what? By blocking the what? By blocking the cause one and cause two, which is the enzymes, which reduce prostaglandin, thereby resulting in pain relief and reduce inflammation and reduce fever. This cause one and cause two, they are the enzyme that alert our body when our body is hot. Thereby, once this cause one and cause two, which they are responsible for the production of this prostaglandin. Now, after they are responsible for this production of prostaglandin, this diclofenac will now block what? This enzyme that is causing the prostaglandin, which they are causing pain and inflammation in our body. Thereby, once they block this prostaglandin, thereby it results in what? Pain relief, and also reduce the inflammation caused by this prostaglandin. And also what? It's also reduce fever. And what's the maximum dose of diclofenac? Maximum dose of diclofenac is 150 milligram per day. NSAID family. And what are drugs that can be combined with diclofenac? One of them is anti-malaria like artemether, lumefantrine, and other anti-malaria drugs. And we also have proton pump inhibitor like omeprazole, pantoprazole. Because why is it that omeprazole and pantoprazole is used with NSAID family? NSAID family generally they cause gastric irritation. Thereby, when administer this proton pump inhibitor with it, they reduce the gastric irritation caused by diclofenac and other NSAID family. And diclofenac can also be used taken with antihistamine like loratadine, cetirizine, and other antihistamine. And what are the drugs to avoid or use with caution when we are taking what diclofenac is. One of them is other NSAID. Avoid when you are taking NSAID, avoid what taking ibuprofen and aspirin and other what NSAID family, because diclofenac is belong to what NSAID family. Taking it together with all these NSAID families can increase in what GI bleeding, and also what anticoagulant. Avoid diclofenac with what anticoagulant like warfarin, heparin, because warfarin they are anticoagulant, they coagulate blood. Now when administering it together with diclofenac, it can cause what GI bleeding. And also corticosteroid, you should avoid it like prednisolone, dexamethasone. Avoid it with diclofenac drug, and also ACE inhibitors or diuretic like lisinopril. They should not be combined with what with diclofenac, because it can increase in what GI bleeding and ulcer risk. And also alcohol. Alcohol has been found to be what to be one of the causes of gastric irritation. Remember, diclofenac is effective when it is used as recommended dose. When you use it more than the recommended dose, remember it can cause what hypertension, peptic ulcer, GI bleeding, and if you are unsure about the dosage, contact your pharmacist or go to the nearest hospital. If this video is helpful, like, share, and comment. Thank you.